we're spending a ton of money, a ton of increased money, but we're not getting the results that we'd like. We are going to insist that if we spend the money, where's it going? Are the programs effective? Are they doing the job? The ones that are, we need to double down on, and the ones that aren't, that we need to get rid of. We also have the problem that most of the people, the vast majority of the people that are committing suicide aren't involved with the VA. So how do we reach them? You know, how do we get the community involved? And so we want to do that. We want a grant process to get those people involved, again, with programs that are working. We recently passed out of committee the veteran suicide bill that is so very important. In it, there's a tool to monitor suicide prevention progress. And what it does is just basically say, are these programs working or are they not working? You know, we don't have any metrics right now. And so that's so very important so that we can beef up the programs that are working and get rid of the ones that aren't. Do you have any advice on, do you have any experience on some of the programs that are working that you feel like are doing a good job?
Yeah, I'd like to have my staff maybe elaborate on some of the information they have been pushed to them across the nation.
Yep. I think first I wanted to say that we're really heartened that both the Senate Veterans Affairs Committee and the House Veterans Affairs Committee, I mean, we've seen so much attention to this issue with regard to mental health, and I think everyone is frustrated that the rates have not come down, and we care for our comrades. And we know that VA is doing a great job with its integrated mental health system in primary care, its peer-to-peer program, the predictive analytics program that you talked about, and a number of other wraparound services that are so essential to make sure that veterans have access to mental health when they're in crisis. But as you noted, when veterans are in the community and they're out there, I think that they're unaware of that they're eligible for VA care, or they're unaware of the benefits that may be there for them and the options. That's where you can use the VSO community. I mean, all of the like DAV, an organization like DAV, we have a wide range. All of our across the system, across the states, there are departments and chapters out there dealing with veterans on a daily basis, our NSO Corps. And we took, as an organization, this really seriously, and we asked VA to come in and do the SAVE training for both of our headquarters as well as our national service officers who meet with veterans daily. We want to be at the front lines and to make sure that if we see someone in trouble, we're going to get them to the experts and who can help. We've got the VA taking care of a very small percentage of actually the people that are committing suicide. Ms. Campos, how do we get the rest of the community involved so that those the 6 veterans that are committing suicide, part of the VA, but the vast majority are outside of the VA. How do we do a better job of outreach in that regard?
Well, I guess I'd like to refer to my comments that that will not happen until VA strengthens its relationship, first with veterans, which is most important, and then from there with the community partners that they have. Right. But they also need to strengthen their relationship with the Department of Defense, because there needs to be that relationship because those women, service members, are going to leave service. And DOD knows some of those folks, and they need to do a better job of those warm handoffs and making sure that they get, at least given a warm handoff and follow through. There's a lot of, as I mentioned, one-off programs, and DOD, our VA does a good job maybe initially, but it's following through. And it really comes down to the relationships with the veterans, because veterans talk to other veterans. And again, there's, we can have bills. We can have some of the bills that are being looked at by the committees, and VA do more outreach, but there already been tasked in a lot of programs across VHA to do outreach, and it's not happening.
Yeah, no, I agree totally. And so what we're trying to do is work with the committees in the House and the Senate, and through legislation. We appreciate the leadership on both sides, trying to make it such that some of these other entities that are doing a very, very good job in this area that are outside of the VA that we're able to give them some support. The other part that's so important is we need metrics. Right now, we're measuring the success of these programs based on giving them money and access, if veterans have access. What we want to do is shift to where we really have some metrics that really do account for whether or not the programs are doing what we'd like for them to do, improving the veterans' mental health and preventing suicide. One of the things that we were able to include is having some metrics. Right now, we're measuring VA suicide by the amount of money that we're spending. We've greatly increased that, but we're not reducing the amount of suicide. And then access. Again, greater access now, but suicide's not coming down. So we need the ability to actually measure what these programs are doing, get rid of the ones that aren't working, and then increase the others. So can you or some of your folks talk to us a little bit about how we can reach those veterans that aren't part of the VA system? About 20 committing suicide. Only 6 or so of those are actually in the system. What do we do to get to those that aren't in the system?
If I might address that, sir. The American Legion Buddy Check program that we have is the best way that I know of to do that. We've got Legionnaires reaching out to other Legionnaires just to say, hey, how are you doing? Do you need anything? Can we help? Is there something we can do to help? We've also need to educate, and this is a public education process, I think, to identify the veterans that are not involved with the Veterans Administration and get them to enroll. That's the biggest thing we can do. You mentioned 20 a day, 6 are enrolled, but those other 14, that's got to be a public society issue as we reach out to those veterans and say, it's okay to ask for help. We need you to let us help you. So we also have our system worth saving. You mentioned metrics. Our system worth saving reviews are constantly visiting VA hospitals to review those kind of metrics that you're discussing. The system worth saving site review, it's not an inspection. What we want to do is identify the good things that are happening and maybe identify some things that are not going so well and provide that information back to Congress and the Veterans Administration. So the metrics we are using. So just continue to provide that information.